Welcome. Today's workshop, The Truth About Liver Cancer, is produced by Blue Faery, the Adrian Wilson Liver Cancer Association. A nonprofit organization, Blue Faery's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, also known as HCC, through research, education, and advocacy. If we haven't met, my name is Andrea Wilson Woods, and I'm the president and founder of Blue Faery. I started Blue Faery in memory of my sister, Adrienne. When I was 22 years old, I got custody of my then 8-year-old sister, Adrienne. There was a 14-year age gap between us. I eventually got full legal custody, and I raised Adrienne all through my 20s until she was diagnosed with stage 4 HCC 1 month after her 15th birthday. This was in 2001, and Adrienne only lived 147 days with primary liver cancer. About a year and a half later, I started Blue Faery because I really wanted to make a difference, and I want to see an end to liver cancer in my lifetime. Now, today's workshop focuses on patient perspectives in the liver disease space. Thankfully, none of our panelists today have liver cancer, but all of them have a liver disease that puts them at high risk for liver cancer. Today's panelists are going to share their experiences about their treatment journey, managing their symptoms, seeking support, and so much more. I'm so excited for you guys to meet them. However, if you joined today because you or a family member has liver cancer, then we do have an incredible liver cancer community. And I'm going to put that in the chat right now for all of you. But all I want you to do is to save the link and come back to it later. So here is more information about Blue Faery's liver cancer community. It's a private, HIPAA-compliant forum for patients and families who are dealing with a diagnosis of HCC. Everyone is welcome, and the community translates into Spanish and Portuguese. So again, if you have liver cancer, please join our community, but don't do it right now. Just save that link for later because we have a really, really exciting workshop for you today. Now, I want to tell you a little bit about Zoom webinars before we welcome our first panelist. So if you need to chat, please chat. Your chat will reach me, the host, our co-host Heather, and the panelist, but not everyone. So in the chat, if you put a question, we're going to ask you to put it in the Q&A. We're going to do a Q&A with all the panelists at the top of the hour, and you don't want to miss it. So again, if you have a question, be sure to put it in the Q&A. The other thing is, if you hear something that really resonates with you, you can use the reaction tool on the toolbar. It's right next to the chat, and you can react with a heart, for example. And now you can see a floating heart going up the screen. So if you're watching right now, I want you to play around with the reaction tool. You can give me a heart, a laugh, surprise, party, clap. Ah, excellent. All right, you guys know how to do this. Fantastic. Also, if you need captions, just let us know by requesting us to show captions. We're happy to do that. And we're going to have a poll for you and a little quiz. So pay very, very close attention. Now, I'm super excited to welcome our first panelist to the stage. Her name is Jenn Jones. Jenn, please join us by unmuting yourself and showing your beautiful face. Jenn Jones is the founder of Sober Livers, a groundbreaking fatty liver foundation program dedicated to providing peer support and education to individuals affected by alcohol-associated liver disease, also known as ALD, so remember that, metabolic ALD, and liver transplants. With a BA in Communication Studies and a certificate in Health Communication, Jenn combines her professional expertise and personal journey of resilience to dismantle stigma and empower others. Sober since 2018, Jenn channels her experience and passion into helping others reclaim their health and hope. Jenn, thank you so much for joining us.
Thank you so much for having me, Andrea. I'm excited to be here today, and I look forward to sharing some information about myself that may be helpful to other people, and very excited to just be part of Blue Fairy and have this beautiful background behind me. I feel like I'm
Okay.
floating.
Oh, you well, and you match. You look fantastic. So, all right, Jen, let's start from the beginning of, let's say, patient journey. I know some people don't like that phrase, but let's start from the beginning. When did you begin drinking heavily?
Well, after we talked, Andrea, before, I started thinking about it. And, really, when my drinking for anxiety happened first was actually after 9/11. I traveled extensively for my job.
Wow.
And yeah, and because of that, after 9/11, I was very scared to fly. So I was actually binge drinking on flights because I would have flights to Chicago. I would have like three drinks, like a drink before I left to get in the airplane, then like three drinks on the airplane, or two drinks on the airplane, and then a drink to wait for my luggage. Oh, the luggage isn't going to be out there yet, so might as well stop and have a drink. And it was also very conducive with a traveling job to sit at a bar and wait for a plane. And so once I saw it, eventually that became untenable in the job I was in. So I left that job and unfortunately got in a very abusive relationship with somebody who was psychologically abusive. And because I had learned that coping strategy of anxiety by drinking, I would drink and binge drink heavily because of the psychological harm that he was doing to me. And so that's where that really started.
Just to give people a better idea, how do you define binge drinking? So I will preface this for people watching live or watching in the future. I'm asking Jen's personal definition, not a medical definition. So how do you define binge drinking?
Well, there is of course a medical definition of drinking so many drinks within an hour, which
Right.
is I believe it's three drinks for women and four drinks for men, but I could be off on that. For me, my binge drinking would happen many times in the nighttime when I would be working late because my abuser was also my boss in an aerospace engineering company. And I would be working late while he would be out on the town with other women, and so I would drink alcohol while I was working, and I would go through like a full bottle of alcohol, within a couple of hours. So that is way more than, the normal for even binge drinking. So I would do that about 50% of the time because we had his daughter 50% of the time. And I didn't, I had so much love when she was there, but when she was not there, I was so absent and I didn't have that support, I guess, system to keep me from drinking.
Got it. You mentioned earlier that you seem very aware that alcohol was a coping mechanism for you. So can you talk a little bit more about that?
Yes, and I think this happens with many women. One in three women are affected by interpersonal violence in their lifetime. And we've been taught, women have been really targeted to be taught that you can utilize alcohol to help you with anxiety. Even our entire culture, you see somebody after a hard day of work on TV, on a show you like, even the medical shows, you watch a doctor who's at work and they go to the bar and they start drinking. And so I thought, this is all I had. And this is the only tool I had at the time. I wasn't in therapy. Therapy was not a thing that I thought someone, honestly, and this sounds a little snooty, but trust me, I've humbled myself a ton by now. But, somebody in my SES, because I was working for an aerospace company, living in a real, and nobody would see from the outside what was going on in the inside. And so it was the only tool I have. So it became a coping mechanism for me throughout the abuse.
And just to clarify for our audience, by SES, you mean socioeconomic status.
Yes. Sorry. I'll throw around acronyms and forget,
That's all
forget
right.
that.
I'll call you out on the acronyms. That's
Thank
all
you.
right.
Thank you.
Um, so had anyone in your family ever been to therapy?
No, nobody in my family had gone to therapy. I was raised by my dad. He's a chemical engineer. And so when my mom left when I was 6, she left because she was really worried that she would do to me what her mother did to her, which her mother was very abusive. Her mother had alcohol use disorder. She was very neglectful. And, it took me a long time to come to terms with that. But she didn't seek therapy, but she definitely had alcohol use disorder. And so it really ran in my family genetically. So that goes to show you that even if you're primarily raised with a parent that does not have a problem with alcohol, because you have the genetics, you can still have a problem. But therapy was like not, we're talking back in 2008, right? And it was just like unheard of.
Well, I don't know. I was in a bad marriage and we were in a lot of therapy during that
Oh,
time.
oh, you actually did go. Yeah, I did go to one couple counseling session with him. And that same night is the night that I called the police on him for the first time. And the next day I was out of that relationship. So that's what therapy did for me.
Wow. You're not the first person who's told me something like that. So I had a friend who went to a therapist, and the therapist literally said, "Your husband's not trying. It's time to find a lawyer because you need a divorce." So, anyway, back to you. Was anyone in your life concerned about your drinking? Friends, family, abusive boyfriend? I mean, was anybody saying anything to you?
I kept it under the radar. I hid the alcohol I was drinking. I remember I had the empty bottles of wine I put in our house in a trash can that never got opened and was never used. And then when he would be out, I would take it to the dumpster and I would dump out all of these wine bottles. And it was my biggest fear that he would find out. And then one day, he had told me that we were going to go to an event that evening, and it was actually to walk on glass. I don't know if anybody has tried walking on glass before,
Oh my
but the night
goodness, really?
before,
It's kind
yes,
of like
really.
walking on fire, walking on, oh my
Yeah.
goodness.
Yeah, that was the plan, that at least. And so he had not come home until 2 o'clock in the morning the night before. I knew he was with another woman because he was not only an abuser, but he also abused me by sleeping with other women. And he wanted me to go to this thing with him the next night. And he's like, "I'll swing by and pick you up." So I'm on the phone with my friend and I'm drinking a lot of wine while I'm talking to her. She's like, "I can't believe it, just friends that could tell you, when you're just talking, like, oh, you need a glass of wine. Oh, you should drink a glass of wine. That'll make you feel better." So I sat on the phone with her and drank like a bottle of wine, thinking he was coming to pick me up. And then he called me and he said, "I need you to come pick us up. We're downtown." And I could not tell him that I knew I shouldn't be driving, totally knew I shouldn't be driving, but I was so scared of the repercussions of if I was to tell him that I had had too much alcohol to come and pick him up, that I decided I made the very big mistake of driving. And after that, then for him, my alcohol became a problem. And then when our relationship ended and I lost his daughter, I lost my job, I lost my home. I know it sounds like a bad country song, but I kept my dog. That's the only thing I
Well,
kept.
I
Still,
I want to I want to circle back to that. That
yeah,
night
yeah,
when you
yeah.
did drive, what happened?
Oh yeah, so I got pulled over, and I got pulled over right in front of our Capitol in Denver, and they were
Oh,
doing a
really?
training exercise. It just so happens that they were doing, so there were a lot of cops then, and they had me do the sobriety test. They had me blow into the thing, and I don't know what I blew, but I knew I did know that I went to jail. And sitting in that jail cell, they told me they were going to call my significant other, and I'm just like, "No, no, no." And I was trying to figure out how to make them not call, and they still called. And then of course the guy's like, "Well, he seems like a really nice person." And I'm like, that's what he does.
Mm.
That's what a narcissist does. So he came and picked me up, and I was just like, oh my gosh, I was so scared of what was going to happen to me. And of course, what I thought would happen did. And it was very shortly after that, within months, that relationship ended. And then after that, I was so depressed and so devastated that I started drinking a lot because I didn't have my daughter. I don't want to cry. I didn't have my daughter. I didn't have my beautiful job in aerospace. And I was so lost. And I was so, I'd already had signs of post-traumatic stress disorder complex. And so I needed mental health, but instead my parents told me I had to go to a 30-day clinic. I was 36 years old and they were telling me that this is what I had to do. But it did not work because they were treating a bunch of other people with other diseases and just going off of this like 28-day Bible book of which you have to go through. And at the end of me leaving, he said to me, he said, well, you can get 50% off when you come back. And I'm like, why would I come back to this place? He's like,
Oh
well,
my God.
he says
You
to
didn't
me,
mention that when we
no,
talked before.
no, no. And he said 50%. And then I said, what makes you think I would come back here? And he's like, you're an alcoholic. Alcoholics always come back. They always relapse. And I was just like, oh man, and it did not, and it didn't work. I mean, it did not work. I was sober for a little while when I came back. And then I still had the same stresses. I didn't work on what was really causing my drinking. I didn't have any therapy. And so once again, I just felt isolated and all alone.
Okay, so I want to just for the audience for a timeline. Um, that DUI you got was in summer of 2008. Is that correct?
That's correct.
Okay. And like you said, you went to this clinic. You never
2000.
mentioned the 50% off before.
Oh, it was horrible. Yeah, yeah.
Um, but one of the stories I thought was really fascinating when we met before, was you did have someone in your life who noticed something was wrong. So at your lowest point, how much were you drinking? And who was this person in your life who said something to you? And what did they say?
I'm trying to recall what you and I talked about because I was
Oh,
at,
your
I was,
nail lady. I would love for you to share about your nail lady because I
thank
think
you.
that's
Thank you.
I
I
think
need a
that's
little.
fascinating.
Yes, this is very fascinating. So we would be my until I moved in with this partner. I was also a real estate guy. So he owned a bunch of properties. So he moved me into one of his properties before he allowed me to move him into his big, beautiful home. And so we would break up and get back together during this time. And we were broken up. And so had been getting my nails done back then, once again, in a higher SES. And so I was able to do that every week. And my nail lady was like, I came in and saw her. She goes, your eyes look kind of yellow. And I would come to this nail place bringing a bottle of wine, right? Because they let you drink alcohol while getting your nails done. And so I'd be sipping on my drink and everything. And she's like, my father died from liver disease, and that's what happened to him. He had yellow eyes, and I was like, oh my gosh, oh dear. And that's the last time I went to go see that nail lady because I was caught. I thought
Yeah.
I was, and I wasn't thinking about my health. I was thinking about being caught because I was an alcoholic, which, I wasn't ready to term myself that. That's what I called my mom, right at the time. I wasn't given tools like alcohol use disorder to try to explain what was going on. And
Right.
so, yeah, it just, and it continued to spiral after that.
Okay. I want to address someone who's asked a question in the chat. DH, please put that in the Q&A. We will do Q&A at the top of the hour. Today, we are talking to people with 3 different liver diseases, all of whom are at risk for liver cancer. And liver cancer is one of the most preventable cancers. And that's why we are talking to these 3 amazing panelists today who are being so open and sharing their story, because it's important to talk about the risk factors for liver cancer. So I want you to take that. I want you to take that question that's in the chat and put it in the Q&A so we can talk about it, because we'll ask our panelists about liver cancer.
Yes.
Jenn, I want to continue with your story, and I want you to jump ahead to 2017 when you got a nosebleed. Tell us what happened.
Okay. Well, in 2013, I got safe, but I wasn't healthy. I was able to actually start therapy in 2013, and but I still coped with alcohol. It wasn't as much alcohol, but it still was a trigger. When I get triggered, I would drink a glass of wine and walk my dog. So in 2017, in the winter of 2017, all of a sudden I got this severe nosebleed. And I had never had a nosebleed before in my entire life. And it was gushing. I mean, I couldn't keep up with it with towels and everything. And so my significant other, Darwin, he raced me to the hospital, which luckily is only about 10 minutes away. They had to cauterize my nose. They had to give me a couple blood transfusions. And then, what you know, I actually fell while I was there and hit my face. And my face got all black and blue because my platelets were probably low. And so I didn't have a lot of good clotting factors. But as opposed to talking to me about my liver, they were talking to me about my head and my CT scan. And oh my gosh, did she have a concussion? And instead of looking at what was really the problem of what was causing that nosebleed, which was my liver. And then I found that out really quickly, come spring of 20 now I'm getting
That's okay.
2000 and
That's all right. Let's
2008.
jump to when you finally saw a hepatologist.
Well, I did not see a hepatologist until I went to the ER with my liver failing, and I was diagnosed with decompensated liver. I was also diagnosed with alcohol-associated severe hepatitis, which is a very severe form of hepatitis that is mostly deadly to most people. And I had about a 30% chance of living. That happened in May 6th of 2018. I didn't see my hepatologist until August. And when I saw him, he told me, he said, well, he goes, some doctors are doing transplants before 6 months of sobriety. He's like, but I don't do that. And I remember this feeling inside of myself, like if I were to look for another doctor, I would be like betraying this person because I was still psychologically wanting to please everyone. And I'm like, oh, this doctor is telling me that he won't do it. If I leave, he's going to be disappointed in me. Right. And so this is how the brain of somebody who's been abused works. And then he basically passed me off to his PA because I don't think he thought I was going to survive. And so she became my main source for everything. And I was fortunate to live past that and not go into multi-organ failure and be here today with only a 30% shot at living. But here, can I
How
mention
did you get sober? How did you
yeah,
get sober?
yeah,
That's what I
let me
want
tell
to
you
hear.
that. That's the important part here. So my significant other, once again, Darwin, brought my dog at the time, Orion, to my bedside every day. I had about 10 days in the hospital in the ER, and then afterward, I went to a physical rehabilitation center. And so that helped me a lot. It was a short-term purpose. And then when I was laying there in the hospital bed, I started thinking about why is it that I'm drinking? And it popped up in my head. I said, every time I take a drink of alcohol, those abusers are still killing me. And that was their goal, and I'm letting them do it. I am passively letting them kill me. And so after I had this vision in my head, that this is what was going on, it was very easy for me to stop. But it's not like that for everybody. So I just want to say, we all have our own stories and we all have our own unique ways of recovery. But trying to find that reason, that trigger, or the triggers that are so critically important, because I really think unless you address that, you're not going to be able to go into long-term remission like I am today. And I never had a recurrence of alcohol, but it's common, and people do
Yeah.
have recurrences and they can get back. And so there's no shame in that either because it's such an addictive substance.
Now, today you're a patient advocate. I want you to tell us more about sober livers. We have about a minute or so left. Heather, would you please drop the link to sober livers in the chat for everyone? Tell us about sober livers.
Well, I started advocating in 2020 for liver health with the Global Liver Institute, AASLD, which stands for American Association for the Study of Liver Disease. American Liver Foundation came next, but nobody was doing anything for patients with alcohol associated liver disease. And I was floored because it's the number one reason for transplant now. It's also the liver disease that kills the most people. It's also the liver disease within the steatotic liver disease category or fatty liver category. It is at highest risk for cancer. And so, that's why I started my organization, because there wasn't anybody there for me except for my dog. And having social support and peer support is so important. So that's what we do. We have meetings now twice a month, virtual meetings, and they are for anybody from the steatotic or fatty liver side all the way to post-transplant. And we have a Facebook group and a buddy system, and we are just flying high this year. I'm so excited. We're starting off with such a good group of people, and we're looking to expand that group and make it accessible to everybody.
Awesome. I see you're wearing a lovely pin.
I
So
am.
I'm not going to ask you the last question yet. I'm going to save that for the Q&A. As a reminder, everyone, we're doing a Q&A at the top of the hour. So we are going to say goodbye to Jenn for now. So Jenn, if you would mute and turn off your camera. And we are going to welcome our next panelist to the stage, Bruce Dimmig. I think I said it right, Bruce. So I'm going to ask you to start your video. Bruce has been a liver disease patient for over 13 years. He has MASH with stage 3 fibrosis, along with hereditary hemochromatosis. All of these words, by the way, can be found in Blue Fairy's glossary. Significant symptoms that he experiences are portal hypertension and hepatic encephalopathy, also known as HE. It is due to these issues that he has gotten deeply involved in patient advocacy for over 5 years now, with the goal of sharing his story with others to support them in their journey and the hope that they don't have to go through it alone or experience what he has. Bruce, I love the last part of your bio because that's exactly why I started Blue Fairy. I felt so alone and I didn't want other people to go through what me and my sister did. Bruce, thank you so much for joining us today.
Well, thank you for having me. It's a pleasure to be able to share my story with other people.
When did you begin experiencing symptoms that told you something was wrong with your body?
Oh, excuse me. It was at the end of 2011. I'd be driving to work, and instead of a car being 100 feet in front of me, it'd be like 50 feet in front of me without even blinking. So it's kind of like, what's going on here? Long story short, I've been working 80, 100, 120 hours a week as an architect. So I had fatigue and stuff anyways, but this seemed a little bit out of the norm. Went to my doctor, did a sleep study. You have sleep apnea. Well, issues still progressed. I still had them. It didn't go away. And then the actual precipitating event was I would have all these little red dots all over my leg. And I got this one huge bruise on my right shin that was really big and didn't go away. So I went in, well, did some blood work. Oh, gee, you have low platelets. Well, sometimes you can get false readings. So we did another one. Well, the reading was even lower. So you probably have thrombocytopenia, which means low platelets.
Right.
Well, that's what started the whole when you get to the old kids game, the leg bone's connected to the hip bone kind of thing. Well, okay, well, you got thrombocytopenia, you got low platelets. Well, why do you have low platelets? Well, you have an enlarged spleen. Well, why do you have an enlarged spleen? Oh, you have portal hypertension. Well, why do you have portal hypertension? Oh, you have liver disease.
So, wow. I can't imagine that. That's such a lot at one time. Um, what were the next steps in getting a more definitive diagnosis? Um, I know, tell us a little bit about the biopsies. So tell us about those next steps, because I know it's been quite a journey for you.
Yeah, well, this was basically 2012 was a blur. I averaged a blood test every 2 weeks, had a bone marrow biopsy, 2 liver biopsies. And to answer your question, the I had seen a GI doctor, and we had done what they call a EGD or upper endoscopy. Found I had varices, which are basically varicose veins in the esophagus.
That is the best explanation I've ever heard of varices, by the way. That's like the perfect, like it's so visual too. Continue.
Yeah. So, well, that kind of precipitated being referred to a hepatologist. So unlike Jen, I was lucky at the beginning. I got to hepatologist within months of the whole thing starting. Well, in order to try to figure out what was going on, like I said, we did the bone marrow biopsy. Okay, it's the low platelets weren't due to that. The first biopsy I had was what they call a transjugular, where they go into the jugular vein down into the liver, and they do two things. They do what they call a venogram, which takes the pressure in the veins inside the liver, and an actual biopsy. Well, it showed that I had severe portal hypertension, and the sample wasn't, as they said in the pathology report, it was fragmented enough that they couldn't make a definitive diagnosis. But at the time, they were thinking, well, maybe it could be cirrhosis, it could be nodular regenerative hyperplasia, it could be focal nodular hyperplasia. It was all over the board. Well, then we did a what they call laparoscopic. They go in through the belly, uh, and that was basically pretty much the same thing. It's like, well, it could be this, it could be that, and then for the next 10 years, it was kind of like it could be just fatty liver, it could be what's now called MASH, it could be cirrhosis, it could be this, that, or the other, and so the next 10 years was basically trying to figure out what the hell was going on.
Um, that's a lot, man. Like what was your strategy? Did you seek another opinion?
Yes. I the one thing I'll put a plug in here right now. One of the biggest things that a patient can do for themselves is advocate for yourself.
A freaking man.
Don't take the doctor as gospel. You know your body, you know what's going on. You advocate for yourself. The one thing I always say is the only dumb question is the one you don't ask.
Oh, that's so true. God,
Um,
I love it. Keep going.
but sorry, with my encephalopathy, what was the question again?
The question was, did you seek another
Yeah,
opinion?
okay. Sorry again. Everybody, yeah, with my encephalopathy, sometimes my short-term memory is terrible. Um,
That's what I'm here for. No worries.
about 3 or 4 years into it, again, it was like it could be this, it could be that. We're not sure. So I actually went to one of the other liver clinics in the metro area where I live, and sought out an opinion there. But again, it was like, well, it's probably this, but we're not sure. So the original clinic I was going to, I kind of bitched, moaned, whined, cajoled, badgered my hepatologist. We need to do something. We need to do something. Well, I was having gallbladder issues, which anybody that has liver issues probably has as well. Well, because they were worried that my liver might be or get cirrhotic, they said, well, let's go and take um, the gallbladder out now. So we did that, did another biopsy at the same time. It was like glutton for punishment that I was. It was like, let's, hey, we're in there, let's do it. And that just threw a further wrench into the problem, because it turned out to be what they call sampling error, because it showed little to no fat and little to no fibrosis.
Oh my
The
goodness.
same that earlier that same year, again, I had badgered her into, I went for a living donor transplant evaluation. And for those that don't know, the liver is the only organ that can regenerate itself. So what they do is, they evaluate you to see if you can, withstand the operation, of course. Well, I was about 3/4, 7/8 of the way through the evaluation when they decided to take it to their transplant committee. And again, for everybody, what happens is when you go through the evaluation, they do all the medical tests and so forth, and then they take it to a committee and say, yes, this person is a candidate. No, they're not. Well, in my case, like I said, they stopped it just like 1 or 2 tests short, and they came back and said, basically, we don't think your issues are liver related, so we don't think a transplant's going to help you.
Oh my goodness.
So again, I was back to to square one or zero or -1. I mean, but I just kept after it.
And you answered the question I was going to ask about a liver transplant, and I just want to throw this at you. Do you think a liver transplant could be an option in the future?
It's yeah, it could be an option. Yeah. There again, I don't want to get too technical, but there's what's called the MELD score, which
Go
stands
ahead.
for model end stage liver disease. This is what they go by, transplant centers. This is what they go by when they want to evaluate and whether you're a candidate for a transplant or not. Now, you you have to be above a certain score. I mean, I won't get too technical here. Well, with my blood work, I have never been high enough to qualify for a deceased donor transplant. Um, so I hate to say, but there's always the thought in the back of your brain that goes, I want to get sicker so I can get better.
Yes. Oh, you're not the first person to say that.
Yeah.
And our next panelist has had a liver transplant, and we'll talk about his journey. But you're so right. It's I know that they put you through like the Olympics in terms of you have to be healthy enough to survive the transplant,
But you have to be sick
but
enough to get
you
one.
have to be sick enough to get one. I mean, it's like it's
Yeah.
this conundrum that I really I think is very messy that has not been figured out. And for anyone who's watching, we did a whole workshop just on liver transplant last year. I want to ask you, Bruce, because you're still in it, right? You're still really very much in this.
Yeah.
How do your health issues affect your day-to-day life? I mean, you used to be an architect. I know you told me you worked like, anywhere up to 120 hours a week. Um, how has this impacted you?
Uh, well, multiple. I have severe fatigue. Unlike a lot of people, my encephalopathy is constant, so I always have trouble concentrating. And like I said, like earlier, my short-term memory is for crap at times. Um, at one point, my hepatologist sent me to the Alzheimer's clinic because they thought it might be early onset Alzheimer's, which it wasn't. Um, uh, I 2013, because of these little micro naps, these mini blackouts, whatever you want to call them, walked into my hepatologist's office. You drive here? Yeah. Well, you're driving home, parking the car, and not driving again.
Mm.
So 2013 was the last time I actually drove. Um, so I have to rely on in the metro area I live in, they have a paratransit system. So I have to rely on that to get to the grocery store, to get my doctor's appointments and so forth. I can't go where I want when I want. Um, I can only basically function for 3, 4, maybe 5 hours a day doing actual activity. Um,
So you no longer work as an architect, I take it.
when I back in 2012, I immediately went on to short-term disability, then long-term, then on Social Security. But yeah, no, I haven't been able to work since 2012. I don't know the exact reasons, but about 5 years ago, my ex-fiance, that'll give you a clue, decided that she couldn't handle any things anymore and left. So uh,
I'm
I live
so
on my own now
sorry.
too. So there's a lot of there's a lot of ramifications.
I'm so sorry. I'm gonna just, warning for people watching now or in the future, I'm gonna curse. If you know me, you know I curse anyway. But You find out who your friends are and your family, and you find out who they are when shit hits the fan. Like you
Yep,
find out who's really gonna be there for you. It's
absolutely.
yeah, it's remarkable. I want to ask, how are you feeling today? It's been a couple weeks since we actually spoke. What, if you've had any, are your most recent tests like? I know you have a particular type of fibrosis. Like, tell us, where are you today?
Basically back down the rabbit hole. Seriously. Um, not I know we're getting a little close, but
You're good.
back in 2022, I had another transjugular done. Well, it was like, well, we think it's nodular regenerative hyperplasia. And that's the other thing I want to warn people is, get your reports, read the reports, whether it be radiology, pathology, blood work, get your records, know your records. Well, they thought it was like a 75, 80% chance that it was this rare liver disease. Okay, fine. So the next 2 years, we kind of went on that one. Well, April of last year, I had another transjugular done for various reasons. Well, this pathologist said, well, it's not the NRH, which is the nodular regenerative hyperplasia. You have MASH, MASH stage 3 fibrosis, which is one step below F4, which is cirrhosis. Or did I say that right? I don't know. Sorry.
You're good.
F3 fibrosis, yeah, and then cirrhosis. Um, so that's what I have now. And then last year did a genetic test because my couple of my blood work items were off. And that's when they did a genetic test and found out that I had hereditary hemochromatosis. Um, so
Is that what could have led to all of this?
probably not, but it's affecting everything right now. Um, it was
Contributing factor is
well,
what they
one of
like
the
to
reasons
say.
why they call it metabolic dysfunction associated steatohepatitis is metabolic related. Well, at the time, many years ago, I didn't realize, but I had high cholesterol, high blood pressure, things of that nature, which are two of the warning signs of a metabolic issue. But as far as today goes, um, last year and now my ferritin, which is your liver iron indicator, it had shot up way high. So right now I'm 3/4 of the way through what they call phlebotomies, which actually drain a pint of blood out of you every 2 weeks for me.
Wow.
So that's going on. I also have issues. There's what's called a fiber scan, which is a kind of like a glorified ultrasound, where they use a probe and they figure out how much fat is in your liver and how stiff it is, which means uh, the level of fibrosis that you have. Well, previous to Tuesday of this week, I my last two had got my what they call the CAP score, which is the fat, and the KPA, which is the fibrosis, had gone down. Well, yet on Tuesday I had another one, and they had gone back up. And the other issue was hepatologists usually keep an eye on what they call your liver enzymes, which are your ALT and AST. Well, mine have been shooting up. They're almost they're 2 to 3 times upper limit of normal. One of
Wow.
the other things too that people need to know is I'm on the only approved medication for MASH stage 2, stage 3 fibrosis. So right now we're trying to figure out, are the changes in my numbers and imaging, are they due to the ferritin and the hemochromatosis? Is that affecting them, or is it the medication, or is it the actual liver getting worse? So again, I'm kind of in that gray
Three
zone,
solid
like
questions, by the
what
way.
what's going on. Kind of if it's okay, I'll kind of go back to the question that somebody had answered in the chat or asked in the chat. For me, what does it have to do with liver cancer? Well, once you get to a certain stage, it's what's called the cirrhosis protocol. You get imaging and blood work at least every 6 months because you're at high, once you get to F2, F3, you're at high risk for developing HCC or liver cancer. So every 6 months, no matter what, I have imaging and blood work to check to see if I've developed liver cancer or not.
Thank you so much for answering that question. I'm going to hold off on asking you about advice you would give. Uh, Bruce, thank you so much for sharing your story, and stick around.
Thank
Bruce will
you.
be back for the Q&A at the top of the hour, or just after the top of the hour. We're going to welcome our next panelist to the stage, Mark Chatterley. We're going to welcome Mark to the stage. Ah, he's already there. He's beat me to his bio. Mark Chatterley was diagnosed with primary sclerosing cholangitis, also known as PSC. You're going to hear that a lot, a very rare liver disease, in 2009. Initially, Mark had very few symptoms, but within 2 years, that changed, and he was being assessed for liver transplantation. He did not, however, get added to the waiting list at that time, and this starts what he calls his limbo decade, where he was very ill, but not ill enough, something you just heard from Bruce. Eventually, Mark got listed in 2020. We all remember what happened to the world in 2020, even in the UK, where Mark is from. But Mark did get a new liver in 2023, and he now works for PSC support in the UK, doing his best to improve the lives of those with PSC. And we will add links a little bit later. But first, Mark, welcome.
Oh, hello. Thank you for having me. I feel like I'm spoiling. Everyone else has had the blue shirts to match, and I don't. So I feel like I've let everyone down. Sorry.
Well, now you have to show everyone your shirt. Like, you just have to.
I do like my shirt, which is contains recycled parts, which I saw someone posted this onto the Facebook group that I'm a part of, and instantly I was on Amazon buying it. It was within seconds.
You might have to send us the link to that, so we'll add it in the YouTube notes. Let's go back in time though. When did you begin experiencing symptoms, and what were they?
So my initial symptoms weren't liver related; they were intestinal related. So I was in my last year of university, and I'm going to be quite graphic, so I apologize for anyone squeamish, but
No, go for
it. Lots of stomach cramps and diarrhea that never really went away. It would get better, but then it would get worse again. And I went to the GP, which is sort of our primary care practitioners in the UK. They completely dismissed me out of hand. It was basically, you're a student, you spend your days drinking and eating junk food, you're gonna have bad guts. And so it never really got resolved, but that was the start of everything. And it wasn't until I had graduated and I was commuting to work that it got to the point where I wasn't able to do my commute to work. It was quite a long commute to work, but I was having to, because there was some cycling involved, I was having to turn around and go back home after I'd cycled a certain way because I needed the toilet, or on the train, I was spending more time in the toilet in the train then. And so when it got to that point and blood started appearing, that's when they finally started taking me seriously. And I got diagnosed as having a bowel disease. At the time, it wasn't quite known what to call it. They called it IBD unspecified. But nowadays, it's got a name linked to my liver disease.
So I think it's interesting that they didn't take you seriously until you got out of college. Like, I mean, that talk about some inherent bias they had. So now you get a diagnosis of some kind. I also love it when the doctors say unspecified. I love it when they say that. So what did the doctors do for you? Was there some kind of ongoing screening? Like, what was happening?
So they gave me some medication, which I reacted to very well, and that stopped all of the diarrhea I've been having for multiple years, and it was wonderful. But part of that was I had to have monthly blood tests, and every month I'd go in and get the results, and they'd go, your liver results are a little bit high, but you're quite a big chap. You're quite hefty. I'm more of a rugby player than a football player, if these analogies make sense. So they just
did they actually call you hefty?
Hefty, yeah.
Oh Lord! Oh God!
And so it got put down to probably excess fat around my liver, maybe the beginnings of fatty liver disease. So I was kind of, again, a bit dismissed, and it wasn't until one time I went, and instead of them telling me that the results, I got a sort of frantic phone call saying, you need to come in and talk to this liver doctor. That I realized that maybe something wasn't as it should be.
So how old were you when you finally got this diagnosis of PSC?
25 was when I got the diagnosis of it. And at the time, other than weird blood results, I wasn't experiencing any symptoms, although that changed over the next sort of 18 months. I started getting pain. I started getting itchy hands and feet, which sounds like a really pathetic thing to complain about, but it's relentless itch. You break the skin, you itch in your sleep, it stops you sleeping. And I was having these periods of time where I would have a lot of pain. I'd feel really sick. I wouldn't eat anything, really huge amounts of fatigue. Nowadays, I know that they are what we call a cholangitis attack. That's an infection of the bile ducts, but I just didn't know the words for it at the time.
So PSC is a very rare autoimmune liver disease. Can you tell people, because I know you went down the rabbit hole when you were diagnosed,
Yeah.
a little bit more about the disease itself, like what's going on in our bodies if we have PSC?
So you're right. It's a rare disease in the UK. About 7,000-ish people we think have it. In the US, about 30,000. So that kind of gives you an idea. No one quite knows the mechanism, what causes it, but the current prevailing belief is that our immune system somehow starts to think the bile ducts, which are the structures that take bile that's made in the liver and take it down to the small intestine. So they're very small kind of tubes inside the liver, and then they get thicker as they join up. And so it's kind of like a tree structure. It's called the biliary tree. But our immune system attacks that. That causes scarring around these tubes, so they get narrower. And as they get narrow, the bile kind of gets stuck there. And because it gets stuck, it then becomes infected, which causes more inflammation, which then the cycle kind of spirals. And eventually that damages the liver and scars the liver.
Okay. Do you mind sharing what the doctor said about the disease itself? The phrase, do you remember?
Yeah, so the doctor was lovely. He's a very clever specialist. He's still involved, so I don't want to name him, but his bedside manner wasn't the best. I was just kind of told, you have this disease, and that was it. He did use the phrase, you're more likely to die with the disease than of the disease, which sounds shocking to begin with, but it's oddly reassuring that this disease isn't the thing that's going to kill you, but it's still going to impact your life, was kind of where they were getting at with that, I think.
I love that. Did he mention liver transplantation at all to you at that time?
So yeah, he said it was a possibility. So for people with the disease, only about 40%-ish eventually get to the point where they will need a transplant. The other 60% can live on with no symptoms or a few symptoms. That kind of varies. But yeah, only 40%. So he said it was a possibility, but it wasn't something to concern myself with at the time. 18 months later, he was saying, you need a liver probably soon. So I remember
so
the phrase
what was
he said
happening with your body then?
So that I was a lot of what Bruce was talking about, actually, the fatigue, the forgetfulness, the beginnings of hepatic encephalology. I can't say that phrase.
You can just say
the
itchy.
Itchy, and yeah, lots of pain for me. Pain and fatigue were two of my biggest symptoms, and itch, yeah, pain, fatigue, and itching are the big three. And so I got very yellow. In fact, what happened, if you indulge me a little story, is I was getting married. Well, not married. We didn't call it marriage at the time. It's to my husband. We were getting civil partnered at the time because we weren't allowed to get married. But I like to think we became civilized, which I think was quite nice. But I went to my GP on the Friday because I was like, the pain's a lot worse than usual. What should I do? My GP was kind of like, if it gets bad, go to hospital, which wasn't going to happen because I was getting married that weekend. So I got married on the Sunday. The GP had taken some bloods. I got married on the Sunday. On the Monday morning, I got a frantic call from the GP saying, I have no idea what to do with your blood test results. You need to talk to the hospital. And then I forwarded them onto the hospital. And on Tuesday morning, I got a frantic call from the hospital saying, you need to come in, we're admitting you to the hospital. And so I had my honeymoon in an NHS hospital, which
How was that?
Delightful. Oh, delightful. It was the food, immaculate. Yeah. If you like custard, you can cut. It's perfect.
Oh my God. Oh, I don't even like custard, but okay. So you were in the hospital for your honeymoon. And you know, at this point, were you finally referred for a liver transplant?
Yes, so they did lots of tests on me, and I was in that hospital for about 4 to 6 weeks. I can't quite remember the exact, but they did every test they possibly could, and they decided to refer me to a transplant centre, which was Birmingham. So it's a little. I was in Oxford. This was in Birmingham.
Not Birmingham, Alabama, where I am
Not
today.
Birmingham. No, that would be a big commute.
Yeah, that would be huge.
But yeah, so that process of transferring me from one hospital to another took a little while. That took about 3 months. So that was a long wait for me. But when I got to Birmingham, my results were starting to get better. I wasn't as yellow, and so they took the decision that as I was not as bad as I had been, that I wasn't sick enough to be put on the list. And similar to what Bruce said, we have the UKLD score, so the UK end stage liver disease score, and I was just below the threshold for that, and that's what began. I as you said, my limbo decade where I couldn't go back to full-time work. I never got that well. So every 6 months for the next year, I would reduce the level of work I was doing. So first I went back part-time, and then I had to leave that job and take a part-time job with fewer hours. And then I started doing freelance work. Then I decided setting up my own company would somehow be an easier thing to do. But it did allow me to control my hours a lot more, until at the end of that 10-year period, as we approached 2020, I had about 2 hours of energy a day. So get up, get out of bed, maybe have a shower. And it's really hard even for me to believe now, but that would be my day. That I would then have to just sit down or lie down on the sofa, sleep a lot, watch a lot of Stargate, SG-1. That was my life. I've got encyclopedic knowledge of a lot of sci-fi shows now.
So you get put on the list in 2020. Not the most ideal time, but how long did you have to wait for a liver? And tell us about the transplant.
So when I got added to the list, the wait times are kind of a misnomer, but the average was around a year wait. But they had to stop the operation while COVID was going on. So I ended up waiting 3 years and 3 months, which was a very, very long time to wait. The transplant itself, it will be 2 years ago in 2 months' time. So yeah, so what's that, 22 months? I'm gonna have to start counting it in years. It's like a baby. I think I've hit that point where you can't count it in months anymore. I got the phone call came at 2 a.m, as these phone calls always do. There was a bit of a frantic to get to the hospital, but then lots of waiting when you're at the hospital. But yeah, they found a liver for me that was a match. It was from a deceased donor, and yeah, woke up with tubes everywhere. And my favorite thing, which was the morphine pain button, which I think I might have fallen in love with. So I mustn't tell my husband how much. If that morphine pump had started talking to me and told me it wanted to elope with me, I would have gone with it. That's
here in the US, actually they might call it there, it's PCA. It's a patient-controlled analgesic, whatever, but patient-controlled, yeah. They do have a lockout mechanism, though. Yeah, they're not going to let you get addicted. But just a little sidebar, my sister was so afraid of becoming an addict like our mother, she would not click that button.
Oh,
she wouldn't do it. And we had to have a nurse, our favorite nurse, I'm still friends with her today, come in and explain the difference between taking pain meds because you're in emotional pain and you're trying to cope versus taking pain meds because you are in physical pain because you have cancer. And because they would not let me as her parent click that button for her. You know, she, even at 15, needed to be the one to click that button. So how did you feel after the transplant? Because I know there was a
So-
pretty sudden difference for you.
Yeah, so the memory of intensive care is a bit fuzzy, as I think it is for everyone. But I do remember my first night on the ward, waking up in the morning and feeling rested and refreshed, which I hadn't felt in a decade. The idea of waking up in the morning and thinking I've got energy to do things is crazy. Oddly, though, you're in a situation where you can't really do things because you're strapped to a hospital bed. But the feeling of it was absolutely amazing. And me and my new liver, we didn't get along to begin with. There's was a bit of rejection. I ended up in hospital for a month. But all through that month, I had doctors and surgeons kind of going, "You're in severe rejection. We're going to have to try this and try that." I felt better than I had in a decade. And it was a really odd situation to have them stood at the end of the bed saying, "You're still very ill." And me going, I feel great. I'm going down to the shop to get a coffee and some sweets. You deal with this.
Oh, and you were no longer yellow, right? The jaundice was gone.
The jaundice, within a day or two, I had gone, completely normal, other than when the rejection sort of spiked, but then it would come back down again. And I still, almost 2 years later, I check my eyes daily because that was just ingrained in me, and they're always white. And that's such a nice feeling every day to check my eyes and go, they're still white. That's good.
And now you are back at work full time.
Yes.
You work for PSC Support. Would you tell us about that? And Heather, would you put the links for PSC Support in the UK and then the sort of other organization that's similar, PSC, I think it's Partners in the US. Would you please put that in the chat? And Mark, tell us, what do you do there?
So my title has changed since we last chatted. Actually, I'm now the operations manager. So
congrats.
Thank you very much. So anything patient focused. So we put on in-person events, and we also do things like this, Zoom webinars that people can join once a month. So those I deal with and make sure they're all running along. And then anything back end behind the sort of charity. So the finances, the systems we use, all of that is kind of my remit to control, and the information we put out. So as a charity, we do events. We work with doctors to make sure that the information is correct, because Google is not a safe place to go if you have a rare disease, or probably any disease, to be fair. What was I saying? Yeah, and we fund a lot of research. So last year we dedicated £500,000 to PSC specific research as a charity. So
my God, that's amazing. That's incredible.
And it's so good to see these researchers and what they're working on, and there's so much hope for the future, and that's essentially what we're trying to push forward. And the same is for the US. I don't know the ins and outs of the US organization, but they have a big event and they fund research as well. So yeah.
And before we welcome all of our panelists back to the stage, I want you to tell everyone, how did you get this job?
So I was in hospital, in rejection at the time, scrolling on social media, and saw their post that they were advertising for at the time, an administration manager. And I sat there with my little happy pump going, I think I can do that. I reckon. And so I applied for the job from the hospital bed while on morphine. I'm actually quite scared to go back and look at what my application said, because it was probably full of emojis and tangents as I went off on stories. Because as you might be able to tell, I'm quite a talker anyway. So while on morphine, it goes a bit bizarre.
I just like that you called it your happy pump. Like that, there's just so many like places I could go with that I will not go. Well, Mark, I think you give everyone so much hope. So I want to invite all of our panelists back to the stage as we get ready for our Q&A. And I'm just going to change this to gallery mode. And we're going to do a quick quiz before we go into the Q&A. But I just want to reiterate a couple of things that our amazing panelists said that resonated with me. Jenn, I love that you talked about getting to the root cause of why you were drinking, and understanding that and figuring that out. And I just think as a society, too often, at least in the US, we tend to treat symptoms and not talk about causes. and even more so with mental health. So I'm really glad that you, really talked about that and got deep. Bruce, oh my gosh, I wish right now, Bruce, I could take you, teleport you, and have you speak to my father. Seriously, I mean that. I loved how you said you have to be an advocate for yourself, that you have to get copies of all your records, that you have to actually read all of the records. I preach this at nauseum with everybody in Blue Fairies community, and I always say that that it's so, so important that you have to be an advocate for yourself. And Mark, I want to give you a lot of credit. I mean, you were very young when all of this started, and you were dismissed because you were a college student, but you knew something was really wrong with your body. And good for you for, just like Bruce and Jen, for really advocating for yourself and to keep going and say, I know something's wrong. I just wanted to highlight that because I don't think enough people are doing that. So before we jump into the Q&A, we're going to do a quick quiz and see what people have learned. So, oh, it looks like the quiz was launched. Heather, I guess Heather launched the quiz. Okay, this is great. All right, so the quiz was, which of the following is a type of liver disease? Alcoholic liver disease. I hope I got that right. I did change it, Jen. What is it called?
Alcohol associated.
Oh, I'm sorry. I did save it. Alcohol-associated liver disease, metabolic-associated steatohepatitis, MASH, formerly NASH, primary sclerosing cholangitis, PSC,
Yeah.
and over 50%. By the way, everybody participated. Thank you. Over 50% got it right. All of these are liver diseases. Unfortunately, our livers can carry a lot of disease. So my apologies, Jen. I did change that and click save, but I'm not sure with Zoom webinars that I might not be able to change a quiz after I've started it. So thank you so much for the quiz. And I am going to go to our first question. And let's see. The first question is, I love it. Not a question. Just wanted to say thank you for sharing your stories. Helping others to not feel alone is so critical. And that's what Blue Fairy did for me on my liver cancer journey. That's from Kara Klink. She's a volunteer for Blue Fairy. So Kara, thank you so, so much for sharing that. I have a question for all of you. At any point, Bruce, you started to answer this for sure, but at any point, did you understand or were you told that what you have is a big risk factor for liver cancer?
Yeah, actually, like I said, I was fairly lucky in that regard. I can't remember whether it was within the first year, but probably within the first year or two, when they really couldn't figure out what was going on. Was it this, that, or the other? Uh, so they basically said that we're going to start the cirrhosis, or if you want to call it the cancer protocol, because they didn't know what was going on. So it's like, well, we better start keep you and monitor you for any signs of HCC immediate,
Wow.
pretty much immediately within the first year or two, probably.
Jen, when you were drinking, even before you went to that one treatment center that was going to give you a rebate when you came back, I still can't believe that. It's horrible. Did you have any idea that that level of drinking could eventually lead to liver cancer?
No, no. My only thought was at the time was, okay, as long as I think the cirrhosis thing is the last step, and as long as I don't get there, my liver will regenerate. I will be fine when, and that's what we tell ourselves. I will be fine when, and I will stop drinking then. And you're never fine enough to stop. And if you don't, it's true. Not very many people know that alcohol causes liver cancer. And so early on, I had no idea. And now that I know, of course, I'm getting scans every month and, or not every month, I'm sorry, every 6 months. And, and they actually last year, they found a spot. And on my ultrasound, I just switched from MRIs, by the way. And I'm sorry to take this over for a second. I just want to say, Bruce, with hemochromatosis, you have to be very worried about what's called iron overload, because it is a feeding ground for cancer. And my PA had given me iron supplements, prescribed them to me, and I started taking them because I was low on iron. And then she stopped checking me when my iron levels were normal. And it took 3 years and belly aches. And I went to my gastro, and she said, "Are you on iron supplements?" And I'm like, "Of course, it's right here in my chart." And she's like, "Oh my God, your ferritin level is 850, which 550 is the normal." So I was very high. And so I just was like, "Oh my God, my chances for cancer just got risen," because I became a researcher when I went to the University of Colorado, and I didn't do that Google research that Mark is talking about. But yeah, I mean, I've had a lot of fear of cancer. I when I saw that spot, they told me they couldn't get me in for an MRI for like a month, and I told them I'd go anywhere. So I ended up going an hour north to Fort Collins to get my scan, and luckily, thankfully,
Just add on to what Jen just said, if you don't mind. Almost every time I've had some sort of imaging, I have what's called hemangiomas, which are little clumps of blood vessels. It's benign, but it looks like a tumor. So every time I get an imaging that says you have a lesion of this, that, it's like, okay, is it cancer or is it just, a cyst or hemangioma? So there's always that scare every time you see lesion on your report.
Yeah.
Yes.
Mark, what about you? When you got the diagnosis of PSC and you were in your limbo decade, did you know that you were at risk for liver cancer?
So there's what's interesting is when you have both the intestinal issues that I had and PSC, there's a very strong link that bowel cancer is going to rise. So there was lots of talk about bowel cancer. We have to have yearly colonoscopies. So I've had yearly colonoscopies since the age of 27. I'm now 41.
Fun.
So it's super fun. It's my yearly ride on the big black snake. And it always comes at Christmas, which is an awful Christmas present. So that's talked about a lot. There's a lot of prevention there. There is a liver cancer that is also particularly scary, cholangiocarcinoma. So it's a cancer of the bile ducts.
Yes.
That is a much higher risk for people who have PSC. There's a lot of research going into it. The scary thing about that is the symptoms of that mirror the symptoms of PSC. And so it is very hard for doctors to differentiate between the two. So I was aware of that, and I'm really sorry, but I can't quite recall whether I pushed that out of my mind because it was just too terrifying to think about, or whether the doctors kind of tried to downplay it as a chance. The chance of it happening still isn't high, but it's higher because you've got it. And so I think I might have just blanked that out of my head because it's like I said, terrifying.
I don't blame you. Before I ask the next question, forgot to share the results. There are the results of the quiz from before, and I'm going to stop sharing those results. And so before we go to the next question, I want to launch this poll. And after participating in today's workshop and listening to Jen and Mark and Bruce, what changes regarding liver cancer care, or liver, in this case, liver health care, do you plan to make within the next 1 to 3 months? And check all that apply. So I see you're still with us, guys. So please answer the poll. Are you going to make any of these changes? Are you going to seek out support from Blue Faery or other patient advocacy groups? We've got plenty in the chat. Are you going to join a community for liver cancer patients and caregivers, such as Blue Faery's patient community? Again, that's if you already have liver cancer, hopefully you do not. Are you going to talk to a mental health professional or other healthcare provider? Or are you going to read educational materials about liver cancer care? And I'd also add liver health care. All right, so we have a couple people are participated. Just so you know, it is an anonymous poll, so nobody's going to see the results. No one's going to see what you said. Thank you so much. We're going to give it just a few more seconds as I see more and more people are participating. We just want to know what actions you're going to take and how this may have helped you. Okay, fantastic. So we
Hey,
have,
Andrea.
yes,
One thing that I know, since this is on liver cancer, I'd like to make us point out one thing.
yeah,
Um,
please.
when you have blood work, if you're concerned about whether you're developing cancer or not, one blood work that they can do is what's called AFP, which
Yep.
is alpha fetoprotein. There's actually two versions of it. There's one basically that women have with pregnancy and afterwards. But the one for your liver, again, it's called alpha fetoprotein. It's not a diagnosis of it, but it's an indicator that if the number is too high, that you need to get further evaluation done. But I know since this is on, Blue Fairy's mission is with liver cancer, people need to be aware of the AFP, that if they're concerned, they can ask their doctor to include that in their blood work.
Thank you so much, Bruce. That's a really, really good point. When Adrienne was diagnosed, they did her AFP, and keep in mind, I had no idea what normal was. And she was stage 4, so she had tumors in her liver and lungs, poorly differentiated tumors. Like pretty much, if you checked a box, the worst thing she could have had, she had it. And her AFP was 1.4 million. And to this day, I still haven't met anyone that has come even close to that. The normal, by the way, for everyone is below 10. And typically people, not typically, a lot of HCC patients have AFPs in the tens of thousands, even hundreds of thousands, but I've never heard anyone to this day as high as my sister. So, and it only went up from there. So, thank you so much for participating in the poll. I just want to share the results. And it's awesome. A lot of you guys are going to seek support, again, either from Blue Fairy or these other patient advocacy groups that are in the chat. Heather, would you please post Sober Livers again? And would you please post Mark's organization as well as the US counterpart in the chat again for everyone? And one person's going to talk to a mental health professional. I think that's an excellent idea. People are going to read educational materials and join communities. That's wonderful. So I have one last question, unless anyone jumps in the Q&A for all of you, is I thinking back on your journeys. First of all, again, thank you for sharing. They were all so different. If you could only give one piece of advice, I know that's tough, but one piece of advice to someone who's in your shoes today, what would it be? And Jenn, we're going to start with you, ladies first.
My advice, if you're like me today, which is someone who has a recompensated cirrhosis, continue to get your scans, continue to get your blood work, I don't care, continue to get your endoscopies. I don't care if you've never had a large varice in your life, if you've never had numbers that are out of range since you were first diagnosed with liver disease and you got your liver numbers normal. I don't care if every single time you've gone in for a scan, it's been fine. Last year, I had large varices for the first time, and they had to be banded. And I was 6 years out, and I had never had that before. So continue that. And I really hope that's my main message, because I don't want people finding liver cancer early is so important, and because it is treatable at earlier stages. And there's been so many advancements. So that's what I would suggest.
Mark, what about you?
I would say make sure to take time for yourself and pause. A lot of, at least PSC, but I'm sure it applies to other liver diseases, it can come and go in waves, the severity of the symptoms. When the symptoms wane and you're feeling better, don't jump back into active life. Take time to rest and heal, because your brain is telling you you need to go, but your body is probably still healing. And I'm terrible for this. I still do it today. I push myself, and then I pay for it. And just give yourself permission to, even though you're feeling better, to just have an extra couple of days chilling out, because you do actually need it.
And Bruce, what advice would you give?
Oh God, to be honest, I can't do one. Sorry. Not to rehash what I said earlier about, advocating for yourself and your records. I guess one of the things I would add is eat as healthy as you can, exercise as much as you can, because some days you're not, you're just not going to feel up to doing stuff. So do as much as you can and keep as positive an attitude as you can, because you and I'll add on to this. Be aware that you're going to have the days where you're going to have a pity party. There's going to be those days where it's like, oh crap, but it's how you get out of that, and getting out of that, that's the important thing, so keep a positive attitude, and those three things will go a long way to helping you.
Oh, that's great. That's great advice. All of that is excellent advice. Thank you guys so much. All right, so we are coming to an end here. I'm going to give you a little bit of your time back. I do want to acknowledge the sponsors for this program. We want to thank AZI and Merck, who supported this program but had no say in the actual content of the program. They just support the program, so thank you so much to them. Also, I want to thank Blue Faery's donors. We really would not be here today without you, without the individual donors. So to keep Blue Faery going, as with all nonprofits, please support our work at bluefaery.org. That's BLUEFAERY. I'm so used to spelling it fast, /donate. And I just want to reiterate again, Kara, who shared earlier, is one of the community ambassadors in our liver cancer community. If you or a loved one has liver cancer, and that would be specifically HCC, our community is available for you. And again, it's for both people who have liver cancer and their families. And often the caregivers are the ones that join first. So I'm going to put that in the chat as well. To learn more about it, you just go to bluefaery.org and you can learn more on the community page. Any parting words from any of you three? I won't put anybody on the spot before we say goodbye today.
I'd like
Go ahead,
to
Dan.
I'd like to say one of my favorite quotes, which
Please.
is small steps are no small thing. Basically, that's the shorter version of it. So taking small steps may be difficult, but it's really no small thing, and that's important to know. And so step by step, you can get there, and as everybody said, advocate for yourself.
You stole my line there. I guess I would just say,
Say it again.
yes, advocate for yourself, believe in yourself, and just take care of yourself.
Nice. Jenn, Mark, and Bruce, thank you so much again for your time and for sharing it today. And for those who attended live, thank you. If you are watching the replay on YouTube, go down below in the description and you will see all the links that we put in the chat today. And that way you can reach out to Mark or Jenn. Maybe we'll even get, a link from Bruce. We'll see.
One of these days.
And then Mark, you're gonna have to email me the link to that shirt because we're gonna put that on the YouTube description as well. Thank you, everybody. I hope you have a great rest of your Saturday and a fantastic weekend.
Thank you.